Good morning. I'm Patricia Brown, and I'm from the Chicagoland Lutheran Education Foundation. I am a parish nurse who serves children in parochial schools. And our topic today is serving school children in parochial schools and parishes. This is a somewhat different journey for a parish nurse. And I will go through and tell you how we established this and what the needs were. First of all, we had to define who exactly, what the role would be, what the needs were in our different schools, and where we should begin, and then what roles would be needed to support it. Chicago or CLUF, or Chicagoland Lutheran Education Foundation, supports 25 schools in the Chicagoland inner city. And these schools are all very diversified, and also very far apart in as far as mileage. So I became a nurse on the go. My background is I have been a pediatric nurse practitioner for over 25 years and a nurse for over 40. In that time, I have served in many capacities, both in the hospital as well as community, as well as university teaching. But this role has been unique in the fact that children that are found in our inner city parochial schools have many challenges that they have to face, as well as the administrators and faculty and staff who do their timeless and wonderful work. So our mission was to serve the Chicagoland inner city Lutheran schools in a very positive way, and to bring Christ to the children there. And with that, we wondered in the beginning of this, with 25 different schools, what would be the health needs of those schools. And as many were being identified throughout by the different schools, and how we could best support them. So I became the school nurse consult to identify needs, and also to see what work we could start to establish from a health perspective. How we went about this is that we looked at our inner city kids, and we looked at the children and their families, and it was very diversified across all of our 25 schools. We have Caucasian, many different ethnicities, including Caucasians, African Americans, Hispanic, Polish, as well as many others. And they all attend at schools in different locations. The staff and faculties, as well as administrators, are also very different, and saw the different perspectives of different needs. So we decided to start with a survey, and we surveyed both parents as well as staff and faculty to see what the needs would be, and then to establish a plan of care from that. We also looked at what our resources were in the different communities, as well as with our Lutheran church and Lutheran resources, such as Lutheran Child and Family Services, Lutheran special education means, and also Lutheran charities, as well as community services in each of the different communities, which again were very diversified. And those were more local resources to help support the children and families that were attending our schools. So to establish the role, we identified that indeed I would help to coordinate all of the health needs in the schools by identifying with the parents, families, faculty, staff, and administrators what particular needs we could identify that would be broad in the beginning, but then would become more specific to that population. So we looked at goals and also the roles to support those goals and what we would need to put into place for programs as well as individual needs. And this we did by establishing different meetings, talking with administrators, talking with families, and staff, as well as, like I said, the written surveys that we did initially. Only one of our churches had a parish nurse that worked with her congregation, and she has been extremely helpful with that school. But most did not have any parish nurse and did not have, beyond their pastors and lay ministers, did not have spiritual health support. So we decided that, joining hands was a good thing, and that by putting our minds all together, that we were able to establish goals overall for CLEF, or the Chicagoland Lutheran Education Foundation schools, but also that were integrated into each of the schools and churches. Certainly, the schools that had a church affiliation did know their congregations the best, and we found that there were some family joint programs that could be shared and established with each other. So I became, and this is not a real clear picture, but actually it's a picture of my car that I travel all over the city of Chicago. And my children, when I accepted this position, made me a tire cover that said, "Nurse on the Go, Helping Children Grow." And indeed, I feel that is what I do. We try to establish the best health environment possible in our schools to promote the health of our children. And with that, saying spiritually that they grow and know the love of Jesus, and that he is there to always support them and to establish their spirituality and health, or their health and spirituality, as well as their academic goals. To establish this presence, we really needed to introduce the role, since there was none other prior, to establish that role. And I went from school to school introducing myself with the help of the executive director, and met with not only the principals and administrators and staff and faculty, but also the children themselves. And as again, we went from school to school, we found that many of the same types of values that were coming in establishing and implementing the nursing role. And this role included what I call the 4 C's. And the 4 C's are caring, coordination, and as we will continue to see. Caring was the first value that we put into place to establish the role was caring. And so I always went to the schools, and no matter what the day was, where we established or came in, always gave support and made sure that they knew I was there to care for them as well as the children. And this was a huge um, support to both the faculty and staffs as well as to the children themselves, but giving the impression that we indeed did care about them and did want their best health for them, both again spiritually as well as physically and mentally. The second value that we used in establishing the role was collaboration. And you cannot have that many schools without having good collaboration with the principals, again, the faculty, staff, and children. All are very different and all have very extremely different personalities for their schools. However, they're all unique and they all bring out the gifts that they have been given. So collaborating with not only, again, the school staff and the children and the teachers, but also the community uh, professionals that we may be referring to or involving in any kind of health care. It really required a great deal of collaboration and collaborative effort of working together, reaching out, and establishing friendships as well as relationships with those all around us. It also takes a great deal with the third C, which is coordination. And coordination was needed in many ways. Coordination of the services within the schools, um, or the programs, educational programs that we brought in to the schools, as well as coordination to any child that may be having a specific healthcare need and needed coordination outside of the school. For example, a child who may have a chronic condition and have many medical needs, coordination was needed to establish a clear communication of what was needed for that child to flourish educationally by perhaps her physician, his or her physician, social worker, outside therapist, etc. So in a situation like that, I really tried to go in and establish coordination of care that all different services or parts of that child's health care were working together for the full potential of the child. And finally, commitment. Commitment was extremely important because um, each, again, congregation was different. We had to look at one child at a time, and commitment to not only establishing health goals and keeping children healthy so that they can become educated and learn the very best to their potential. Took a lot of commitment from pastors, from administrators, principals, the teachers themselves, who are extremely committed, as well as to the parents and families that were in that school system and congregation. And we really did it one by one. What we have learned has been tremendous. And the projects that we have chosen, when we established our surveys and concluded them, we found that there were both goals that we could establish for both the children and their families, and faculty and staff, as well as faculty and staff. It wasn't just the children, but the people who were serving the children also had needs, such as a death of a loved one and grieving, or perhaps they had strong anxiety about a family problem they were having, or perhaps they were having a certain situation that made them very distressed. So it was learning that we were, by establishing a school health nurse, parish nurse role, we were establishing a um, role that was going to be helpful to all. And while we initially thought going in, it would be the children, but it really, in working with all the schools, we established both working with children as well as the adults that were involved. One of the things that we did right away and that we're deeply appreciative of is volunteers, and schools varied with this. In some of our schools, many of our schools, parents were working 1, 2 jobs to keep their children into a parochial school, even with substantial support. And they didn't have a lot of volunteer time, but they did appreciate and develop time in whatever capacity that they could, whether that was in the evening um, or in the daytime. Volunteers would sometimes be short. We many times did not get as many as we would always want, and that could slow a screening down, for example, or it could be one that would be lacking and slow things further down where we would need more support. But we did get through it, and we did finally get the volunteers that we needed. One of the things that we found was very helpful is that we made educational posters, and per the survey, we found that disease knowledge needed to be broadened. Many students, families, as well as the staff and faculty, many times did not have the correct information about health, disease prevention. And we wanted to be proactive, such as washing hands. And we needed that to be reminded every day. So we used what we call posters on the move, which educated, we put them in the entrance or the hallways of the school, and it educated parents as they dropped off their children. They could look at certain educational, we may have a pamphlet, I might be there at times, or a handout to give to them. But where they could look at and get information about immunizations, about good hand washing, about a certain disease entity, flu prevention, for example. And I also turned this into kind of a fun thing for faculty and staff, in the fact that we might make a quick quiz, and whoever got the quiz got a quick prize. Whoever won, who could answer all the questions about a certain disease, etc., to test their knowledge. But it was always done with good fun and also a good learning to all. The children also enjoyed this, especially in subjects such as like when we would go over washing our hands, and learning to do that as the single most best prevention against disease. So it was very helpful for them too to be able to see that on a picture form. I became visible as much as possible, and we did this through not major means like in the newspapers or on movies, etc., but we did it through the school newsletters. I made sure that I had a theme of the month And that theme of the month might be promoting immunizations. It might be a mental health issue. It might be flu precautions. But I always put a small article in each of the newsletters to remind families that indeed a nurse was available to their school at times, and that they should try to promote the health being established. That made me think outside of the box also. And sometimes when parents were dropping their children off to school, I would just meet them at the entrance and, just to wish them a good day. And this, again, was a way of connecting with them and reminding them that, again, the role was there if they had any questions. We started out with many projects, and it continues. Our work is certainly not done, but we have completed some projects that were identified in those initial needs in that initial survey that we did with both families, children, as well as faculty and staff. And we celebrate those because we know that we have established health needs. For example, one of the things that was not being done in the parochial in the inner city schools was hearing and vision screening. And we know as nurses how important that is to children who are trying to learn. And if they do have a deficit with that, if they can't see the board, if they can't see and hear everything that they should, then that will impact their learning. So I am hearing and vision screening certified, and we screened over 1,400 children my first year. And these were from preschool through 8th grade. And we established those that did need, and we did find that some children did need glasses, or were vision impaired and needed further follow-up, as well as those that may have had a hearing difficulty, whether temporary or permanent, and again, got them follow-up. We also made sure that the staff, the faculty, and the administrators were CPR, AED, and first aid certified. And this was across our 25 schools. And we either renewed them, or if they had gone out and gotten it on their own, or for the majority that did not, we certified them in these areas. And this was something, because I am not at all schools every day, it was a reassurance that the faculty and staff would know first aid and know what to do if a minor to moderate occurrence did occur. One of the challenges that we have been able to identify through survey and observation is mental health challenges. And we are finding that on the increase in our schools, that our children are dealing not only with very large amounts of stress, with what they see, hear, and do in their neighborhoods, as well as grief, as well as anxiety and depression, and many times low self-esteem and feeling a great deal of frustration. This is still an ongoing concern, and we are working to not only hopefully provide some new avenues for counseling in our communities, either by local community agencies, which are very few and far between, or also by, with the support of Concordia University, delving into new avenues that may hopefully provide us with new resources. So we are trying to meet those challenges as quickly as we can and in as fast as we can to children who are of need. This is not a typical parish nurse role. I don't work with just one congregation. I many times work with over 20. And I am always, like I said, it is always a blessing when we have a parish nurse in the congregation that is available. Unfortunately, that does not happen. But I think parish nurses can learn a lot when they have an adjacent school to share with any school nurse that is in the vicinity, or if I know oftentimes the um, uh, uh, load to carry um, and just meet the congregation's needs are many. But this also extends in some way or another to the school children that also attend the school of the congregation. So it's important to maximize time and experience, to teach when we can to the school children, even a simple hand washing reminder, even if you only can do it once a year and depart from the congregational duties, can be a tremendous help and is very positively received. We must also offer our visibility and support to school children. Again, whether you're in a congregation and a parish nurse in a congregation that does not have a school, you have families that are attending school with children who are attending school, and offer your support to them also as you go about with your parish nurse responsibilities, giving support to the families who have school children and are dealing with a lot of the many concerns that are now addressing school children that were not there even a few years ago. The important thing is, that I've learned throughout all of this, is that we indeed have a great God who is helping us to serve in the inner city as well as other areas. And that by joining hands, whether you are a parish nurse in just a church congregation or just a school congregation, you can join hands and serve with gratitude in providing healthcare needs to others, whether children, family, staff, faculty, or administrators in the school setting. Thank you very much for the opportunity to address you in this time. And I also want to thank Janet Klotz from the Chicagoland Lutheran Education Foundation, Marcy Schmore, who is with the LUMC Parish Nursing and International Nursing, and Carol Bulwark from Milwaukee, Concordia, Milwaukee, who have all been mentors as I have established this role and continue with it. In gratitude. Thank you very much and have a great day.